Guys, how are you? My name is Bhavin. Thank you so much for taking up time to view this webinar. So I'm the CEO of the Aligner Growth Coaching Program. And today I'm really excited to share some amazing news with you guys. And most importantly, to help you guys for no cost, right? For no cost, we're going to help you guys to take your aligner work to a different level. So when you reach the end of this webinar, there is a special gift which involves CPD and some insane stuff, just because we really want to help you guys to level up. Because right now, when I'm recording this, I know come the end of the year, there's going to be a recession. There's going to be super inflation and things are going to get really tough. And I want to make sure you have all the resources and everything that you need so you can keep leveling up and leveling up. So the theme behind today is to say, I am possible. So what we've done here is take the impossible and add aligners. Right? You can literally have the life that you want. So you're probably wondering, what is the life that I want mean, right? Imagine having low stress, low risk, huge amounts of money, working 3 days a week, having huge amounts of energy, having that time to do other things, be it with your wife, the kids, hobbies and passions, right? That's what aligner dentistry offers. And that's why I love this concept. And to have that, you need to be into mastery. So let's talk a little bit about me and my journey. Where that I recently, on a pro rata basis, become the top Invisalign associate for the whole of Europe, the Middle East and North Africa, achieving what they call is Apex, right? And it's been a long journey. I started off as a full mouth reconstructive dentist. For health reasons, I had to stop that. So I went and started Invisalign. And as you can see, I've shared my LinkedIn profile, right? We're not hiding anything anywhere. So you can see in 2015, 2018, as an associate, I formed a brand called Clear Braces Essex. And I was what they call the first intrapreneur, which was I was working at a 10 surgery NHS practice, doing lots of UDAs, and year on year being the fastest growing Invisalign provider in the UK. So then I transitioned, and then you can see it says freelance Invisalign dentist, right? I would then go to dental practices and provide Invisalign. So at one point I was working over 12 practices as I was phasing into just doing the Invisalign. And as a result of this activity, I'm now described as, the authority on how to grow your Invisalign in general practice using 7 strategies. One of them is marketing, but there are many ways in which we can share how you too can achieve these types of things, right? First thing we're going to do is we're going to share some secrets, right? How do you go from a full mouth reconstructive cosmetic dentist to starting Invisalign and year on year scaling? So let's go through this, right? So the secret number 1 is, how do we start, let's say, at least 8 cases a month over the next few months, right? And here we're now going to describe some of the secrets, and I can see that we've cut something off on the bottom. So this is what we call the GDP evolution model, yep? So what if your patients understood that they had problems inside their mouths, they knew the problems, the consequences, and the solutions? What impact would they have? So the first thing you're going to say to me is, yeah, but how are my patients going to know this? And in dentistry, we call it point number 1, co-discovery. Co-discovery is a new concept where we use EQ and what's called patient tour guiding. At the end of that, the patient is like, oh my God, Mr. Dentist man, I have a problem. What does that mean? And then we have a conversation based around the problems, the consequences, and the solutions. So the medical word for consequences means prognosis, right? We need to explain the prognosis of doing nothing and of delaying treatment. Because what we know is that orthodontic relapse is a dynamic and destructive disease. If we leave this for 2 years, it means more aligners, more IPR, right? More IPR or removing of healthy tissue. And now we get to understand that when the patients understand prognostically what delaying treatment is, the impact of that. And hence point number 3 is prognosis and the implications. Sorry that my face is covering the text right now. Once the patient now has all this information, they see you as a healer. Yep. They see you as providing preventative advice. Because the opposite of this is, let me leave your teeth, let's wait for things to get really bad, and then I'll give you a really expensive cure in 15 years, which might mean a full mouth rehab, right? So they absolutely love this. And because you have engaged with them, educated them, empowered them, they now feel as if they want to buy a solution. And when they buy from you, guess what? You never have to sell again. Let's hear from Coco, who's a 6-figure associate who's absolutely knocking this out.
Joining his courses and sort of listening to all that he has to share with us, especially his trade secrets, I've now become that 6-figure associate.
So what if you were able to become the go-to Invisalign area in your area? Well, let me tell you about some of the apex providers that we've helped, be it Chet, Amir, Niraj, Mamta, George, right? Some of these are the top 1% of Invisalign providers in Europe. And what they found was through the diploma programming, where we go through co-discovery, EQ, patient touring, guiding, they were able to bring around a way in which patients absolutely loved their Invisalign treatments. And then they had a new problem. I have so much demand for Invisalign. How do I do insane numbers? And this is where technology is becoming an enabler for change. So we call this the Justin Bieber moment, right? Justin Bieber literally did not have a recording contract. He went onto YouTube and just started singing baby, baby, baby do, right? And the technology meant he became an overnight superstar. With the people whose names I mentioned, they've not been big providers for like 4, 5, 6 years. They literally had huge amounts of demand, but technological advances, the way in which things are now done means they were able to scale and become the go-to guys. And you too can do that. And we'd love to show you how all of this works. So here is the secret, right? I can't believe I'm giving away all of the secret. This is the blueprint, and it's purple color, but let's just call it the blueprint for success. If you follow this, starting 200 cases within 18 to 24 months is a no-brainer. If you're already at a diamond level, getting to 400 units is a no-brainer. Now, obviously, it's not as simple as we've made it look here, but the point is, when you go really deep into the nuances and the protocols, right, what you have here is a bit like how to do composite edge bonding on a tooth with tetracycline staining. There are ways in which we can show you exactly how to get to the next level, because you can now see that these who are working this way, right, they're working less hours, more predictably, more profitably, and they have a team. Because one thing that we are really, really passionate about at the diploma program or the coaching program, so to speak, right, is how do we unleash the talents of your team? Let's hear what this young lady had to say. Hey Zoe, how are you?
I'm good, thank you.
Right, how was your day today?
Really good, positive.
Good. So the last time we met, I said something, and what did I do to you?
Made me cry.
And you let me back near you again?
Yeah. Didn't even say just about.
So this morning you said you were really confident, you'd practice scanning, photographing. Did I still lay into you or did I let you be?
No, you laid into me.
Good. So What did you learn today, and what was the value of what we were doing today?
So I learned that it's important to build rapport with the patient and to educate them on Invisalign. I learned how to talk them through their scan, their outcome simulation.
All right, hang on. All right, on that. So most nurses are like, I'm not a dentist. How am I going to do that? So how are you able to talk to people about how their teeth affect their gums or their bite or something? Is it easy, or do you have to be a dentist to do it?
No, you definitely don't have to be a dentist to do it. I tell them what I see when scanning, and I talk to them about the problem, the consequence if we don't solve the problem or do anything about the problem, and the solution.
Okay, I love you, because you get a gold star now. So what you're saying is, when you see someone with a problem, you articulate what the problem is, you educate and help them understand it. You're then, from the iTero scan, explaining the consequences of not doing anything.
Yeah.
And then you're explaining how Invisalign is providing the solution, so that by moving their teeth it improves their health. Is that what you're saying, using big flash dental words?
Yes.
And you did that today?
Yes.
Did you feel out your depth?
No.
Right, most important question. Did the patient appreciate it, think, wow, that was amazing? Or were they like, what the hell are you talking about?
No, they appreciated it.
So that means you've engaged and educated that person, which is insane. What was the most important thing you found for people to say yesterday?
We have to gain commitment from them.
How did you feel asking for commitments and asking people to go ahead?
So at first it was not that comfortable, but then I realised the importance of it, and then you can tell then how interested they actually are in Invisalign, and then how serious.
All right, so now back to the chat we all had, where everyone accused me of being pushy, and I'm straight talking. Is asking for a commitment being pushy and aggressive salesman, or is it just being straightforward and saying what we're doing?
It's just being straightforward and upfront.
And when we were more straightforward, what happened in the afternoon?
More people paid their deposits.
Simples.
Yeah.
So I'm so proud of you. You're amazing. So let's see what my client Priel has to say about this. Hey, how are you?
I'm good, thanks.
Perhaps you could introduce yourself.
I'm Priel Crosby. I'm the principal dentist at Northway Dental.
Perfect. So why did you call me here today?
So I was struggling with my consultations and getting the patient to commit at the end. They'd all be super excited, but at the end, just couldn't get them to commit.
And today, everyone so far has gone ahead, right?
Absolutely.
So what changed or what switched?
Just the format of the consultation, asking the right questions at the beginning, listening, telling the patient what to expect from the consultation and the deposit price before you start scanning, so they can start thinking about it. The way we talk about the scan to the patient, it's not just about aesthetics, it's the health implications to having their teeth straightened, and just nicely finishing it off that they actually see a lot more value to why they're having Invisalign.
So I said I was going to give the secrets, but guess what? We're now into bonus secrets. Absolutely unreal, right? The one thing that we found is that if you right now want to start these extra units and you're not looking to do marketing, right? There is what we call our dental mastery formula. Our mastering your dental happiness flow. And this works on two areas really. Your energy, or how you feel inside, and your outlook. So what we've come to realize is the top dentists who have joy, happiness, abundance. These are the guys that you see straight away at the conferences because they're happy and they're smiling. They're not the miserable ones with their heads like this, stressed out over dentistry, right? And we've done a huge amount of research on how to level up and get to the next stage. And it's all down to your element, your energy, and your environment. When you are looking to get to that next level, when you're looking to have that life that you want, what you're going to realize is that your environment is going to start to talk to you. So you need to block out the negative voices and be around like-minded growth people. That's where being in the Olympic village, that's what people call our coaching program, right? It is the Olympic village. When you are around peak performance people who are growth minded, that environment will nurture you. Then it's about your energy. How do you prime your energy so when you're at work, your energy is infectious and your patients are like, wow, if you're so energetic and about my teeth, imagine what you're going to be able to achieve, right? So we will go through what the top Invisalign and aligner providers are doing right now to keep their energy at peak states so that as they grow, they don't experience burnout, anxiety, and worry. An element. One of the most important things that we found when it comes to being happy is being in your element. If right now you're doing GDP work, NHS or something, and that isn't your element, I'm sure you can see why you're not feeling that sort of, that happiness and juice in life, right? For me, my element was I just love cosmetic work. I love seeing how we can transform people's smiles, and doing the NHS for me it wasn't quite doing it for me. So being in your element is so important, and having that anchoring and congruity. And this is a lot of the things that we go through in the coaching, which is pretty deep. And then when we look at science and psychology, it's really clear that those people who have a positive outlook, who are persistent and consistent with what they do, how they do it. Those who are cool with delayed gratification, right? That means being patient. And I get in a Uber, Amazon Prime world, it's not cool to be patient, right? We want instant results. But on the journey of happiness and true growth, it's about being patient, being persistent, and always having a positive outlook, which is what people call trusting in the system. So as part of this bonus stuff that we're literally giving away to you guys, we're giving all of our trade secrets away, right? You're probably wondering, how does someone like myself, so I work in East London at a mixed dental practice. On most days, you've got granny, grandma, little kids running around, NHS people, dental plan people. And you're probably wondering, how do you do so much Invisalign when you don't have a powerful Instagram, you don't do cosmetic cases on Instagram? And what you're seeing is that there's a system and a strategy that underpins that. So this is what some people call a pipeline or a sales funnel, right? Pretty cool. And as you can see that we have layered and broken this down. And right now, the top people out there who are doing insane numbers are doing exactly what we're teaching them with this. We literally train the top aligner providers in the UK on how to get to the next level. I'm sure everyone can now see that within 2 to 3 months, if you are consistently, persistently being able to fill up your funnel with 80 prospects and you convert 20 of them, that's 20 cases. Sorry, that is 16 cases. Then what happens if you convert 30% or even 40%? Now suddenly you're starting 32 cases a month, and that is right there, the game. It's building a funnel for you and your practice and knowing what realistically is the number that you can pop in. If, like me, you work in a practice where there are other associates around, then you know you're going to get more. But it's you building your pipeline, structuring your pipeline, and making sure you consistently and persistently are achieving this 80 number. Then it's, how do I go from 20% to 30% to 40%? And at some point you become apex and you don't even know how it happened. But you're probably saying, Bieber, but just, I don't know, I don't get it. What are the keys to success? Just give me one thing that we can do, right? Recently I had a really cool conversation with someone who we've been helping, who's now become one of the top people. And as a practice, within the last 12 months, they've scanned over 1,000 people, right? Think about that. There's no marketing, which means there's no cost. It's just scanning. So there is a new paradigm shift, right? So in the old days, orthodontics was up here, the cherry on top of the cake. It's now the foundation on which oral health is built. Because if we live in a world in which There's less, I don't know, caries, biomechanical disease. There's less periodontal disease. There's less of everything. Everything is now flipped. So oral health is now about straight teeth and a balanced bite. Just imagine you had two twins coming in for a hygiene and one had Invisalign, right? The one that's got the crowded teeth, you're going to be there for 20, 30 minutes, right? Sweating away, scaling that person's teeth. Whereas the one that has the straight teeth, 5 minutes, scaled them, polished them, profied them, and they're out the door. So we see straight teeth equal healthy teeth. And we see that a balanced bite equals healthy teeth. So the number one thing we're going to go through is scanning, right? How do we use a scan? How do we use smart and intelligent digital data and dynamic concepts so that the patient now looks at the information? And this means being able to hack how the technology works, because obviously, right, the people that make these machines do not intend for it to be used in the way of doing dynamic digital diagnosis. But it's these data points that really empower the patients and really help them to do what they want. So if right now you're thinking, this just sounds insane, I can't believe I haven't been through the program already. I can't believe that in a year where I know my Invisalign is going to drop, in a year where I know that recession, inflation, so many things happening, I need to protect my income and my Invisalign. What can I do? The answer is simple. Invest in yourself. The best investment you're ever going to make is in you, and that means you having the strategies and the know-how to get to the next level. And right now you can see exactly what we're doing, and we literally have an amazing offer, right? An amazing offer. All that you need to do is to click on the link on the side and let's have a chat and let's go through this, because right now is the time. Oh, there's some coming in. Yep. Right now, we're going to give you a no-brainer offer. That is absolutely right. There is a huge discount. Correct. Very, very good question. I can't see what your name is there. My eyes are sort of not as good. But yes, this is a level 7 diploma. What is my commitment? That is an absolute great question. You're not going to spend more than 2 hours a week. What's the next question there? No, this is not a clinical diploma. It's not an academic diploma. It is a business growth diploma. Brilliant. I absolutely love that question there about community. The goal of this program is to say that in the Olympic Village, being around like-minded people is how we're going to grow. So there's a 3-day residential where we spend all that time together. And then every week there's an accountability group where we help support each other. If you're feeling down, just come on there saying, look, I knew I had to do this. I was meant to do this. Feeling really shit about myself. And then everyone picks you up. And I'm just being told by someone else that yes, there are actually other gifts that we'll be giving out as well. Not only will we be having a free chat, not only are we going to give you free CPD, not only is there a huge discount right now on the program, we're also going to talk about our Invisalign pliers and all the things that we're doing out there right now. Are there any more questions? Because, right, exactly, start booking in. Really well done, James. I'm really glad that you clicked the link already and booked yourself in. Well done, Anthony. I'm really glad that you clicked the link. And wow, I can already see 6 people who've booked themselves in. Guys, do not miss out, because we're going to have a 30-minute chat. It's not going to cost you extra. You're going to get CPD. We're actually going to give you a free aligner growth module just because we've had the chat. What was that there, Teresa? Really, really good question. Yeah, absolutely. The reason why you need to do this right now, Teresa, is if you have enjoyed doing your Invisalign, you don't want to let that disappear because of the recession. If the marketing is not going to work as well, then we need to find a way in which you protect yourself. And when we got back to that sales funnel, there were 7 things on there, right? One of them was marketing. So the great news for you is, Teresa, you can work on the other 6 things that are on there. And can you see how it's going to protect you? I'm glad that you typed that in there, Teresa. Yes, yes. Click the link right now and let's get you in. What's Scott saying there? Scott, I'm really glad that you just signed up, buddy. Abdul has now signed up. Wow. I think I'm going to have to ask you guys to stop booking yourselves in. So if right now you haven't booked in, book yourself in, because with already 13 people having booked, there's not that many slots left, because you can imagine how busy my diary is right now. So right now, click the link. If you haven't clicked it, click it, click it, click it right now. We're going to have a chat. As I said, there's free CPD. There's loads of stuff we're going to give you. We are here to help you. This is the year where you achieve your dreams and you get everything you wanted. Thank you, thank you, thank you so much for your time today, and really excited to speak to all of you very soon. Bye.